I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I am thrilled to welcome back Dr. Bill Stiles, a world authority on the process of psychotherapy. In this conversation, we discuss the fever model of distress disclosure, therapeutic responsiveness, theory building, and much more. And please feel free to leave a comment below, and if you enjoy this conversation, it'd be appreciated if you hit the like button and subscribe to the channel. This episode starts with Dr. Stiles talking about the fever model of a disclosure. Let's jump in.
The fever model, which we have a history of talking about the fever model apparently, this was, for me, it was a very early thing that pointed towards responsiveness. The fever model was again a kind of a null result, which was that the following on this little study I said that we showed that clients were doing disclosures and edifications, that they were talking just sort of subjective and they were giving information about themselves, subjective and objective. That's what was the client role. We also did an equally little study. We actually used the training manual for the experiencing scale. I don't know if anybody remembers that anymore, but it's a kind of a measure of good process. And the experiencing scores had a super high, I forget what it was, but a really high correlation with the percentage of disclosure by clients. So that as clients, if in the rated segment, the proportion was high, then that was good process, so that was really, it was high enough, it was, I forget, but it was like 80s or something. I mean, for our kind, in our business, it was a correlation that said, wow, we're talking about the same thing here.
I should just take a moment to say that. So the experience scale is sort of like a measure of depth of experiencing of whatever you're talking about and sort of making sense of it. But I always sort of think about it like my short, it's not totally just depth, but that's, I feel like a big part of it.
Yeah, depth is depth. And I mean, it was kind of like it came out of the person-centered shop, and the idea was that deep experiencing was an avenue to change, and what you were trying to do with therapy was to get people to experience these things. And what was the rated scale, was just turned out to be very similar to the proportion of verbal of disclosures as defined by verbal response modes. And really the response modes definition was not exactly what you would probably think of as, it overlaps, but it's not exactly the same. It's really subjective versus objective. So if people were talking subjective, then things that were going on inside them that you couldn't tell you have to ask them to find out if it's true, that kind of thing. Then it's good process. Okay, so disclosures are highly correlated with good process, as person-centered therapists were viewed it anyway. And but disclosures were uncorrelated with outcome. So so you would think that good process would lead to good outcome, but it didn't happen, just like all the other verbal response modes. I mean, client disclosures were not predictive of good outcome, and the logic was kind of a beginning of a responsiveness notion was, well, maybe it's like a fever, and the idea of a fever is your temperature goes up. And that's a good thing, because it shows that your body is responding adaptively to the presence of a microbial invader or something like that. You raise the temperature, and the whatever the microbe is has trouble surviving that, and so it's the body's adaptive response. But you would not expect, so it's a good thing. The process is good. But you would not expect the people who have the highest fevers to necessarily get better. they would not necessarily have the best outcome of their disease. The people who didn't get a fever probably didn't have such a serious disease, and will probably may do better. So the disclosure is kind of like a fever, but the idea being that disclosure is an adaptive response to psychological distress. That is, if you have a lot of distress, if you have a serious problematic experience, then it's adaptive to tell somebody about it, and getting it out is a good thing, but that doesn't mean that the people who have the most distress are going to do the best in a psychotherapy trial. In fact, could very well be the opposite. The people who are most distressed typically don't do as well as other people. So the failure of the correlation is not surprising. It's a responsiveness explanation. That's kind of a long-winded way of talking about it.
So if we just look at disclosures as predicting outcome, the problem with that, the reason why it wasn't showing up in the way that you thought it was, is because disclosures in this sort of analogy, I guess, are like a fever in that people who are disclosing more are doing so because they're in more pain.
Yes.
So that if we just look at disclosure, that's so highly correlated with pain that basically the people are different people, right? Yeah. They're different. They're experiencing different things, which lead. So the high disclosers are also the high pain. On average, right. Obviously we're speaking generalities here.
Yeah, no,
so to
right.
say, well, high disclosers are going to do better overall, that might be true if we could control for the pain that they started with.
Yeah.
But because it's so highly correlated with pain, you're really asking, what you're pretty close to asking is unintentionally is the high pain, or testing the high pain people will get more better.
Yeah.
And
right.
It's like, well, that's
obviously not. Yeah. Right. If we could completely control, if you could make everything the same, and let some people talk and some let people not talk, and prevent some from disclosing the way they want to, then they probably wouldn't do as well as the people who had a chance to disclose. That's why therapy works, probably. And the people who can disclose, who have the do better. So we would like to think that, but if you throw in all these other people, it's as I say, it's a responsiveness explanation. It means that the people's disclosing is responsive to their pain. It's what they need to do. But it doesn't.
Right. It's like this adaptive coping mechanism, this adaptive feature, just
right.
like a fever is an adaptive feature.
Right. That's the idea. But it doesn't mean that the people who have the highest fevers are going to be the healthiest any more than the people who do the most disclosing are going to be psychologically the healthiest. It's because it's an index of distress. It's an index of pathology. In the population.
Right. Yeah. And so
it's not a controlled experiment. You're absolutely right.
But. Right. Yeah. Well, no, but so I stumbled across this work a while ago, because I was doing work with a colleague of mine, Jeff Kahn, and he's been doing it for much longer than I have. And so he was fortunate to sort of take me on and support me and stuff I was interested in. But he's done a lot of work on like how folks who are more depressed, how depression impedes their disclosure, and sort of this idea of that folks with depression, that this sort of natural, if we wanted to use the term, emotion regulation strategy of disclosure, that one of the things that's sort of getting in their way is that they aren't disclosing, so those sort of, and right. And so like, it sort of gets to, right, when we think about these, one of the things with psychopathology, broadly speaking, if we think about it like, folks with consistent psychopathology there's something going on that is impeding that natural healing process, right? That sort of effective thing that's going on that people experience. And so the argument that, well, disclosure is an adaptive way of dealing with distress. And so with folks who are depressed, if they are in fact not doing that, then that's going to get in the way of them feeling better. And I think that, I would argue that this tendency is, it's a tendency. It's not just limited to folks who have depression. But yeah, just thinking about that. So anyway, so I thought that your work on the fever model was really helpful as I was parsing through this and trying to make sense of like, well, what's actually happening here?
Yeah. No, that's really interesting. So yeah, so that by essentially it would be analogous to preventing people from having a fever. That if somehow,
right,
if depression somehow keeps people from doing this natural thing that would fix it.
Yeah, no, that's exactly right. And so, I have two younger kids. And so, as a parent, particularly when they're little ones get these fevers that are, to us, it's like this, we got to go to the hospital, but like the idea of, and that's what I thought that your work was really influential for me. And that was actually probably when my kids were very little. Yeah. And it was like, this makes sense, right? Because as a new parent, you're all the time. Yeah, sure. Right. And you're making sense of it, right? You're having to learn about why does my infant have this experience and what should I do? And, this actually is adaptive and I shouldn't give them this medication to reduce their fever right now until it gets to a certain point. Yeah, so the parallels I think work quite well. Yeah, so I think one of the things in terms of your work on responsiveness, and I read your paper with, I think it was your paper with Adam Horvath maybe?
Oh yeah.
Yeah, and it really, it still sort of sticks with me, which is that sort of this paradox, if you will, that when we're thinking about responsiveness, we don't know if what we do is actually responsive until after the fact. Like we don't know if what we do is responsive until we see how the client, like its impact on the client.
Yeah.
So, I think about that a lot, because it makes it, as a researcher, it makes it very difficult. And it's really, it speaks to, when you were looking at just the verbal response modes, why it wasn't playing out, because it didn't take into consideration what the client needed. And it didn't take into consideration, and then it didn't, it wasn't also tapping, well, did this actually help the client? Like what was the client's response or reaction to my responsive intervention? And I just think about that a lot in my own work. Yeah. When wanting to do research and wanting it to be meaningful. So I guess I was just sort of, since I had you here, I just wanted your general thoughts and where you were with that at the moment.
Yeah. Okay. This is, for me, responsiveness has been more a problem than a solution. Stock in trade. To start with, being responsive is a stock in trade for therapists. That's the whole thing we do. Is we try to do well. A little semantics. Responsiveness. I think I think it helps me at least to think about it not as necessarily a positive thing. Responsiveness just means doing your behavior being influenced by emerging context. And so, if my idea is to cheat you out of your money, I can be watching very carefully and be very responsive to what you do and get all your money. And I've been extremely responsive, but it was not benign. So, that's just a semantic clarification. I think for therapists, we assume and mostly do have, I think, pretty benign motives. We're trying to help people. But to be strictly, really what we're trying to be is what I would call appropriately responsive. That is, we're trying to do the right thing. And so that it helps, I think, to be, when you talk about instead, responsiveness is a good technical term, a good umbrella, but actually we're saying do the right thing. Okay, well, so it's clearer when you say that that's a puzzle. Do the right thing. It's not like we can. It's not like we have a manual that says what the right thing is. The right thing depends on all these things. Lists. We've made lists, and you can easily list 100 things and go to somebody else and they can list another 100 things that go into determining what the right thing is in a particular circumstance. It depends on who you are, who the client is, what the circumstance is, what the history is, and so on and so on. So you don't know what the right thing was until you see if it turns out right. I think that I think we said before that it's we're trained and adapted to do the right thing, to get we have some idea of what the right thing is. And I think we, on the whole, I think people don't do a terrible job of that. But yeah, okay. So where was I going with this? I don't know if I've answered your question yet. Repeat it. Come back at me. Let me see if I can answer it better.
I think that it's this idea of, it's really a challenge for, I guess, for therapists and for researchers. As the therapist, and I can particularly speak to novice therapists. That's who I spend most of my time with.
Yeah.
Right. They're kind of right.
They don't know what the right thing is. They're novice therapists, but they're not novice people for the most part. And mostly they get selected for being able to be, to be socially appropriate. Most of clinical students have always been good listeners, and they got pushed into this because their family and friends found them helpful to talk to. So they come in as a relatively talented bunch, and then they get better, hopefully.
Right, and they're constantly, but particularly novice therapists, they constantly want to know, like, what do I do? What do I do?
Oh, yeah.
Right.
Yeah.
And so they are looking for, and I did this too, right? They do want
Me too. That's why the response modes were so helpful. But yeah, go ahead.
Right. But they do want a cookbook, right? To an extent. But what the responsiveness work is saying, like, well, there isn't. No, there
isn't. Not really. It's not following instructions. It's not like, there's not a cookbook for, I agree. It's a responsiveness problem. And then, I've been more, I think it is a really interesting question how therapists do decide what to do. How do they decide what their responses are? Expert therapists, and then, how do they, maybe you could look at whether one of the really interesting things, and this kind of leads to is, I even have a name for this thing. I call it the Persig phenomenon, which is that people can tell whether it was right or wrong. It's quite astonishing how raters can rate with good reliability whether people did the right thing, given all the circumstances, which is I don't know. Did you ever read Zen and the Art of Motorcycle Maintenance?
No, I never did.
Okay, it was a popular book a long time.
Yeah, I've heard of it. Yeah.
I recommend it, but it was written by Robert Persig, and that's where the name for Persig phenomenon comes. And he goes, it's a story about him taking his son on a motorcycle trip across the country, but it's mostly a meditation on a lot of things, and one of the main things is what he calls quality, and how people can identify quality. They can tell you when something is a good one or not a good one, but they can't, in general, tell you what quality is.
Right.
And I mean, I think that's what we're dealing with here, is that people that
Huh.
doing, that we're doing you can do the right thing, and people can, to some extent, I mean, not perfectly, but they can tell whether they're doing the right thing or not. And other people looking at it can tell whether it was the right thing or not. But it's just bloody difficult to say what exactly it is that, I mean, you can say post hoc what was good about it. That
Right.
part we can do. But to say in advance what the right thing is, what is really good about anything, but specifically about therapy responses, to specify is, it's really hard.
Yeah, that's a really interesting point, and I take your point too about being able to see it. I know that in like process research that I've done, when you're reading transcripts and going, you can sort of see like, oh yeah, all right, these two are moving somewhere. Like they're on the same,
Yeah,
they got their, this is doing well.
yeah,
And then you read other transcripts and it's like, what is this therapist? Why, you're missing, they just said, and you're not paying attention to. And, and especially, there have been many times where I'm reading transcripts, alone, and I'm sitting in the office yelling at the therapist,
yeah.
as I'm reading, but it gets to your point though, of like, it is somewhat self evident, although it might be difficult to
Oh yeah.
articulate.
Well, I don't know that. I'm not sure everybody gets it right, but it is possible. You can do a lot better than chance at rating these things, and people do a lot better than chance at doing the right thing, I think. But yeah, far from perfect. But,
So I think before we close up, I wanted to chat just briefly about theory building case studies.
okay. Yeah.
And you've done a lot of work on this, both applying these, but also methodologically
Yeah.
talking about, or just sort
Yeah.
of developing methods for doing these sorts of things. And I think probably a lot of the people listening will be, well, I can only speak for myself, maybe, that I'm relatively, naive to these and how they work. So I'm wondering if you could just sort of give us sort of a 30,000 foot view of,
What
what,
theory building case studies is?
yeah.
Well, I think of it as really just an application of normal science. That it's that, if you read the textbooks, the method textbooks, they'll say that what you do is you have a theory and you make observations and see if the observations fit the theory. That's science. And if it fits, then your confidence is increased. If it doesn't fit, then your confidence is decreased. But they don't always say this, but in fact, it's also an opportunity to adjust the theory so that it does fit. And I don't think any part of this is novel, but I think it's important. It's important for psychologists just because we've spent so much time thinking of the statistical hypothesis testing as being like the way, like that's what we do. I mean, because it's a logic that can be used with qualitative research. And I think for doing psychotherapy, I've come to think this is like, I did statistical hypothesis testing for years, and so this is kind of a conversion quite a while ago now. That for most of the things that we study and care about, we don't have statistically testable quantities of observations on the same variable to do the test we want. And so, we can say, all right, well, we'll look under the lamppost and only study things that we can get lots of observations in order to do statistical tests on. But I don't think I don't think that the scientific logic requires that. You can look in an individual case. I mean, and our theories, psychoanalytic theory, cognitive theory, all the theories we have that are used clinically, to the extent that they're used clinically, they describe particular cases. You apply them in particular cases. They're not okay. This is anyway. So all case study is doing is looking at cases and seeing if it fits the theory. And if it does, your confidence is increased. If it doesn't, then you change the theory so that it does, but keeping in mind that all the previous observations have to still fit. So you can't just change the theory any way you want. There's a little piece of logic in this that actually traces to do you know who Donald Campbell is? Anyway, Donald Campbell I don't know. He was a famous methodologist back when I was in graduate school. This is many years ago. And if you've ever heard the terms external and internal validity, does that sound vaguely familiar? Okay.
Yeah, of course.
Okay.
And then is this Cooking Campbell? Campbell of Cooking Campbell? Yes. Yeah.
That's the guy. Anyway, this is his logic. He spent a lot of he was a statistician among other things, and he spent a lot of pages saying mean things about N of 1 studies. You can't conclude anything from them. And then later in his career, he wrote a paper called "Degrees of Freedom in the Case Study," where he quoted all these mean things that he'd said and explicitly retracted them, and said, well, maybe there is something to this after all. And I'm adding a little bit to his logic, but basically what he's saying is, if you have a theory that deals with many different aspects of a person, let's say, or of anything really, but as you do, if you have a theory like the assimilation model is describing a lot of things. So if you did a case study, there's a lot of specifics in that case study. You can point to the voices, you can point to the experiences, you can point to the meaning bridges, and so on and so on. It goes on a long time, and they're all doing these different things. And in a case study, you can make observations on all of those things, on lots of things. Okay, so in a case study, then you can make a large number of theory-relevant observations. And what he's arguing is that those many observations on different things is analogous to degrees of freedom in a statistical hypothesis testing study. So that rather than making across many cases making one observation on each case on a particular piece of the theory, you make many observations on different aspects of the theory in the same case. Okay, now neither one of those will prove the theory. I mean, one statistical hypothesis, one significance is nowhere close to a proof of a theory, but it gives you more confidence in the theory if it works. And likewise, one case that fits the theory very nicely gives you a little bit more confidence in the theory, and it's based on if you counted those observations, nobody, including me, has actually tried counting these things yet. But the principle is that if a rich description of the case fits the rich description of the theoretical account, then that gives you justification for a little bit more confidence in the theory. And a lot of case studies, just like a lot of hypothesis testing studies, gives you more confidence, and it's always a matter of increment. So what that's just saying is that qualitative. So there's a qualitative observations, and what this is saying is that qualitative case studies is an intellectually respectable way of doing science. And there's no reason to say that's there's lots of ways things can go wrong with either kind of study. It's not like it's not perfect, but at least it's on a very similar footing. and it's a respectable way to do real science. That's my point. And that's what I think. That's basic. That was sort of Campbell's point. He didn't give quite the emphasis to theory that I do, but I think that what this really rests on is having a theory that you stick to, and you have to use the same theory across a lot of cases, just like you have to use the same theory across a lot of statistical hypothesis testing studies. A side note here in this polemic is that a lot of actual psychological research is what Thomas Kuhn would call fact gathering rather than normal science. Normal science is puzzle solving around a theory, but a lot of psychological research, not just in psychotherapy, is not really theoretically
No,
guided.
right.
It's just gathering facts in the hope that maybe somebody will someday put them all together or something like that, or that we'll just use them, use them by analogy. Say, well, my situation is sort of like this thing, this study, and so I can conclude something. But I mean, that's even weaker as a scientific logic. The scientific logic has to do with theory. That's the whole point. That's the product of science, is an account, a theory in the sense of an account of the real world that allows you to that makes a connection, so that it tells the truth about the real world, so that what the words of the theory say, it corresponds in your experience to your experience of the observation. Okay, so does that make that's kind of the theory building logic, and I think it works. I mean, Freud's a great example of somebody who did this. He used qualitative case studies to build a theory, which has its strengths and weaknesses. Of course, it's far from finished. It's got its problems, but it also has got quite a bit of staying power. And
So I want to hit on the as with any theory, there's a lot of tentacles to any, or a lot of hypotheses to any theory,
yeah,
and so is in terms of what you're saying, so I can test or evaluate any number of those in a single case study, which gets to your multiple degrees of freedom within a single case,
right,
within a person,
yeah,
or within a dyad or whatever.
yeah.
Most likely, if one were to do this, then I would think the most likely scenario isn't, oh, this whole theory stinks, or this whole theory is great. It's probably that a theory has its strengths and weaknesses, and some things that are going to hold up over time and some things that aren't, as you talked about
Absolutely.
Modifying your, so is in terms of thinking about this as building theory or refining theory, would it be something like, so if we look at a bunch of aspects of the assimilation model, I'm just sort of picking this out, that it would be that after doing a number of these case studies, and we start to see, oh, you know what, this one hypothesis that we had within this theory that had a dozen hypotheses or whatever, this one seems to consistently not hold up. So we're looking for that consistency across a number of case studies to really, before we sort of modify our theory, rather than. Sorry, go ahead. No, go ahead, please.
No, I think absolutely. I mean, there's a term that David Rennie sort of rescued from. Anyway, slipping my philosopher whose name slips my mind at the moment. But anyway, called abduction, and that you changing the theory. You're allowed to change. The abduction is he wanted to make it a logical operation like induction and deduction, and I mean, and induction sort of gets sometimes what Rennie and damn, I can't remember his name, was a 19th century philosopher and anyway that is it gets folded into induction, but he says it's a separate thing, which is that when that it's the creative process in science. It's justified if you see something that doesn't either is not covered by your theory or is mispredicted or whatever is an error, then you know you knew my wife's here and she reminded me it's the guy's name is Peirce, Charles Peirce, but he's a philosopher. I'm impressed that she knew that. She's heard me say it lots of times, but anyway, that's that you see something that's an anomaly from the point of view of the theory, and the logic is if I were meant to make this change in the theory, then the theory would account for this. Then adding that little twist to the theory is called an abduction. So it's a creative thing. It's a way. It's sort of saying I can change the theory to fit. I always want to add when I say that. I think I said this once before that that you can't just add anything. It's sort of like making the theory fit the data, and it is making the theory fit the data, which of course is in the long term is the whole point. But you have to. But you're strongly constrained by all the previous observations. That's why you have to have the same theory all the time. That is, you can make a change, but if that change means some of the previous observations don't fit anymore, then you're not allowed to do it. You have to make a theory that changes. So the more observations you make, the more constrained you are. But also, if you can come up with a change that fits, then the theory has gotten more powerful. And so the idea is that you're forever making these little tweaks in the theory, sometimes major tweaks, but even those are constrained, and the theory just keeps getting better and better. So you can start. The nice thing about this is you can start anywhere. You can start with a crappy theory, and if you're diligent about making the observations and making sure that then every time you see an observation that should fit but doesn't, you change the theory so that it does, then the theory keeps getting better and better and better. So it's and the fact, and I would make it even the condition even stronger. A good theory should explain everything. So if it doesn't happen in just one case, if there's just one case where there's something that doesn't fit or isn't explained, you first look at the method. Maybe your observation was wrong, or something like that. But that's justification for changing it. So case studies, you've got all these rich observations. You can make a lot of. Any case study will have lots of things in it that are not really explained, and so it's just a matter of your attention and creativity that will allow you to improve the theory, to make changes in the theory. That if they and yes, the more cases you have, then that it constrains the theory more, of course. And the process of doing that is far from, it's much looser than I'm describing it now. What people actually do, but I think that the process is it works. I think.
Yeah.
And it's very freeing because it means that we can use what are amount to clinical observations as for science.
Right. I think about this sort of work, particularly in our field where many of our graduate students are going on to be practitioners, not researchers. And so they're dealing with cases all of the time. And that, to use that to inform science, but also to use that to inform their practice, and sort of the value of, learning sort of these sophisticated methods of doing case studies, I think is something that we've been talking, at least locally in our program, about how can we embed this more into the program, because
Yeah.
I'm very much did not get this training,
No, I
but
didn't either.
right, but and I think that your work and others that really is moving us forward in our thinking is really valuable, and something that I think that will be
Yeah.
being increasingly picked up on.
Well, I think so. I mean, I want to just with that kind of future in mind, I just want to bang on the idea of theory. I mean,
Exactly.
and theory building is maybe. I mean, it's theory guiding, theory refining. It doesn't mean building a new theory. I
Right.
mean, so one kind of, I mean, grounded theory is, it often gets,
Right.
is a different thing altogether, I
Mhm.
think. I mean, I mean, enriching, well, that's another conversation, but there's a thing I would call enriching qualitative research, which doesn't have theory guiding. It's sort of, the idea is that
Mm.
you just sort of open things up and see more things. And I mean, theory is part of it. You can make up a theory, but every study has a different theory. I mean, that's not, I mean, it's a valuable human activity, but it's not science, I think. And
Yeah.
so anyway,
Yeah.
and
So,
so I think that's an important feature. Yeah.
no, yeah, I very much
Yeah.
agree with that. So one of the things I always like to, at the end of these conversations, is I'm always curious if there's any pushback that you've received for any of your work overall.
When you, yeah, that was on your list of the other question that was on your thing. So I thought about it a little. I had fun for, it was actually a part of research that we did some outcome dodo research with a great big naturalistic data set in England, using the core, mostly with Michael Barkham, and using the core, which is a
Mm-hmm.
measure. It's a symptom inventory checklist distress measure, and which is widely used. And we had like tens of thousands of people in a couple of studies, and they were, and who, according to their therapist, were treated with either cognitive behavioral therapy or person-centered therapy or psychodynamic therapy, and uh, and the outcomes were exactly as the dodo said. We had thousands and thousands of degrees of freedom, and non-significant differences between these treatments. Well, it's naturalistic, and there's a zillion things that can be wrong with it. And David Clark, who is and a couple of his colleagues who were who's an advocate of CBT and sort of the architect of a big program there, improving access to psychological therapies. Anyway, he wrote a quite critical complaint about this, because I don't know, I don't want him to he favors cognitive therapy, put it that way, and was said mean things about us, and we wrote a rejoinder, which I thought took him to task about some things. So anyway, so that was pushback, and that, it was actually great fun from my perspective. And I think there's nothing more fun than getting attacked in print, but but I it
What?
is what.
Why? Why do you think that there's nothing more fun
Oh,
than being
it's
attacked
a
in
lot
print?
similar to I think it's similar to no such thing as bad publicity. It's a chance to. Well, I mean, it's like a bit like what we're doing now, except that it's there's time to be thoughtful about what the issues really are, and to take somebody to task and pull apart their arguments, and I mean, he pulled apart some of ours, and he was right in some respects, and he was wrong in other respects, I think. But anyway, I found that fun, but um, but the I mean, the the other kind of pushback I had that occurs to me is about the responsiveness, which was, in a way, it
Hmm.
was not exactly pushback. It was like, I've been writing about this stuff, the correlation problem and responsiveness, since at least the late 1980s. I've been putting it in those terms since at least the late 1980s. And the response I got, I presented at conferences, I wrote papers that say, people would say, Bill, that's great. That was a really good idea. And then they would go back and do process outcome correlations, the same as they were doing before. And so the pushback was, they would say nice things, but actually it didn't seem to have much impact. Now, it had a sort of a happy ending because, you know, starting, I don't know, maybe 10 or 15 years ago, the responsiveness kind of got some play, and people have actually been working on it more seriously. So I sort of feel like, I got lucky there. But well, it wasn't lucky exactly, because I banged on about it for all those 30 years, 40 years. It was, I've been, I don't know how many times I've written about this stuff, and it's an example of what we mentioned earlier. I think of people don't read it. People aren't influenced by it, and it just takes a long time for these things to settle in.
Well, yeah, I mean, that gets back to sort of at least how I think about like at least the what of Kuhn that I've read, sort of like that you're trying to change the conversation, and that like changing the conversation is not an easy thing, right? And so you sort of do have to bang on about it, but it is
Yeah.
I think it's a good lesson, or a good reminder, I guess, that like just because, one thing feels like a, drop of water in the ocean, that if you keep with it, that there's value in that. So the other thing I always ask, and you sort of is about, one or two resources or readings or whatever that folks who want to learn more about your work, and you sent me a lot of them. So I'll list all of those in the show notes,
If you want.
which is great. I think it's wonderful. Is there, are there one or two in particular you want to point to people to, or do you want me to
Well, no.
just
I
sort
mean,
of?
what I sent you was because we've covered a bunch of different topics, I've been in this business a long time, so I've had time to do different things, and so it depends on what things people are interested in. No,
Right.
there's no one. It's just a matter of which topic they're interested in. But
Yes.
and
Yeah.
there's
Okay.
lots more. As I said,
Oh,
I'm delighted if somebody wants to write and get more reprints. There's more about all this stuff.
thanks so much for watching. If you found this helpful at all, please like the video and subscribe to the channel. I'll see you in the next video, where we continue exploring the science of psychotherapy and applied psychology.